Welcome back, everyone. Here today with the medical equipment world, healthcare, and get the scoop. And so, in this episode, we're going to be talking about why families waste thousands on medical equipment, and how education can change everything. So, once again, the focus of this podcast, is to really kind of help educate you guys out there about the medical equipment and what's out there. And we do see a lot of mistakes happening, and people are spending thousands of dollars making multiple purchases and really being frustrated because everything they're purchasing seems not to work. And so we have Tara here today, and what she's going to really be talking about is diving deeper into all the different layers on why things go wrong, whether it's lack of education, whether it's because people just don't understand. And so the first question I have for you, Tara, is what are the key mistakes that you see families making?
Okay, so hi everyone. I'm excited to be back on the medical equipment world and healthcare get the scoop. So Silas, so one of the things that some of the topics that we see people families struggle with is once they get a prescription, they don't know really where to go or what particular product that they're being they can see what's being asked on the prescription, but they don't know which steps to take at that point in time. A lot of it is a lot of confusion with the insurance because they think that it's compared to prescriptions and medication. So, if you get a prescription from the doctor for medication, you normally can just walk into a pharmacy and pick it up, right? And you can get it. But medical equipment is totally different from that. And so when you get a prescription for medical equipment, there's a process and you have to find out if you're in network. We have to run your eligibility to see if we as a provider is in network, but also make sure that your insurance is going to cover it based on medical necessity and a prescription. And one of the things too is very challenging is because a lot of times families think that because the doctor write a prescription that that's all that's needed. And unfortunately, that's not the situation. It has to have, well, first of all, the prescription has to be very detailed as far as what's needed, diagnoses, length of need, patient's date of birth, the doctor's information. Also, too, if the doctor is writing a prescription for a medical equipment, a lot of times families don't realize this either, is that the doctor has to be in what's called PICOs. He has to have the approval to be able to write a prescription for durable medical equipment. So if you go on there and you put his MPI number in the system, it'll tell you if he's eligible to write a prescription for medical equipment. And if he's not in the system and you bill for that particular product, the insurance company can deny it. So there's a lot of different steps. I think that doesn't get talked about enough, and it leads to a lot of patients and families being frustrated because they feel like they're getting the runaround. But I just feel like when you know better, you do better, right? And so that's one of the things that we see. We also see a lot of times patients will get a prescription and they're told to just go online and get it, right? Well, get what? Because there's so many different things out there and layers to that. How do you even know really what you're getting? And so, unfortunately, sometimes families they go along because they're thinking like, okay, well, let me just go in here and get this rollator or this wheelchair offline or what have you. Especially if you're trying to get it from the insurance and you're feeling like insurance is taking a long time. And a lot of times it's not because the provider wants it to take a long time. That's not the situation. But there's so many different steps. Once the doctor writes the prescription, I'll go back to that. You need medical records. When you get the medical records, if the documentation is now outlined, medical necessary on the reason why you are getting this particular product or why the doctor is writing for this particular product, then we as a provider have to go back to the doctor and ask for additional documentation to make sure that it's going to either meet criteria if the patient meets criteria. So that's another thing. A lot of times providers may want to do it, may not, based on the allowed amount. There's this different things for that as well, because there is a fee schedule. It is public record on Noridian that if you, an example, just say if it's a rollator, the billing code is E0143, E0156. That's for a rollator and a seat, a walker with seat and handbrakes. When you can go on there and look and see what the allowed amount is per your state. If you're in a rural area, if you're in a non-rural area, it's going to tell you what the allowed amount is, right? And so those are the different things that goes into all of these moving pieces. And while a lot of times families are like they don't know because no one's telling them the giving them the details, right? And so that's why I felt like we really need to talk about this because it's getting worse. I see it every day and it's just so sad because we get so many families are calling and they're like, oh, I can't get this. Why I'm not, why is it taking so long? And all these things. And we try to do a good job in trying to explain that to them. But if they've already been somewhere else, they're frustrated at this point, right? Because they're trying to just figure it out for their loved ones. They're just trying to get the right product for their loved ones. So that's one of the things that we see that's really really huge, and in that is when not understanding on the details of what a provider has to do in order to make sure that they get the product if it's provided, if it's medical necessary.
So that's really good. So essentially, it's more so just a change in the process. So it's obvious that
Mhm.
the DME equipment side of the process of the insurance is just more of there's more layers to it. There's a lot more hurdles you have to get through, mainly because of the codes and the paperwork has to pretty much be in 100% alignment.
Yeah.
And you to also talk about some of the things of why that is, as far as like, for example, I know from, just talking to some DMEs, they always say, well, there's a thing where the 7-year rule where, CMS can pull money back from them if the documentation is not all the way correct, right? And so that's another reason why things are slowed down, because maybe versus where it's more, the paperwork doesn't have to be as exact in pharmacy. You can get things same day or the next day, but because of those rules, the stricter rules,
Mhm.
DME just slow things down and say, look, we're going to make sure everything is really, tight before we give you this equipment,
Yeah.
just for we're so that we're audit ready. So can you explain that too? Because I believe that, if people understand what on the other side, I like the full picture, kind of like you're explaining right now,
Mhm.
it now starts to make sense on why, it's not as fast or rise is easy because of those, different types of hurdles.
Yeah. So, well, yeah, CMS and insurance, they do have up to 7 years to recoup money. And what that means is that if when there's different other things too, reason why they can recoup too, but one of the major reasons, so if you get audited and they come in and they say, okay, I'll just give you an example. They want to see 5 files. They want to see this particular patient, this patient, this patient. And if they do an audit and whatever they're looking for is not in there and they've paid you for it. So an example, I'll say a bed. So you've provided Miss Jones a bed and now they're auditing you. They want to see Mrs. Jones' file. When they get the file, they look at it and the medical necessity does not meet the criteria because it's a trust. It's like they're trusting us to give this particular product out, knowing that we've received everything that we were supposed to receive, right? Outline. So whatever that is, doctor's order, demographic sheet, copy of all these things that they look for, right? One definitely is the medical necessity, the report, the chart notes, all those things. And so, and it's kind of interesting too because I know doctors really get frustrated, also with us as providers because we're asking them constantly to go back. Can you please do this? Can you please make sure it doesn't show that this patient needs this, like, based on these medical reports? Because a doctor will write a prescription for a bed and there's no bed mentioned in the reports, or outlining. And if it is a bed written down, it doesn't show why it's needed, right? So those are the things that causes a delay in the patient receiving the equipment. Now, if you're in a hospital and you're being discharged, depending on your benefits, then you might be able to get a bed the same day. It's a possibility. Okay, that happens as well. But we do see a lot of patients getting discharged, and the medical information is being not there, or the patient's at home and they've been home, but now they need a bed, and the family is like, I need this bed, and the doctor wrote the prescription, but what's taking so long? So those are the things that we have to have because they have up to 7 years to take the money back. And so now Miss Jones has this bed. It's 6 years now in, 5 years in, and they're doing an audit, and you can't prove the medical documentation is not suffice enough to for them not to recoup. So now they want their money back. It happens. I've known people who provided services and got their money, the money taken back. They was, did some repairs. I'll give you an example. They did repairs, but they didn't provide the product. They didn't provide the scooter. An example. They didn't provide the scooter, but they repaired the scooter and they billed the insurance for that and the slew of them, and they got their money recouped. So there's a lot of things that go on behind the scene that people don't know. And so I just feel like if people know, they can have actually better prepare themselves to say, like, okay, I understand. Now, granted, some companies do take longer than they probably should, right? But a lot of times it goes back to what's going on behind the scene, which is the medical documentation, eligibility. And a lot of times you can do eligibility with same day, depending on your volume or, and things like that, or 24, 48 hours, 72 hours, things like that. So that's it. But the mostly time it is the medical records that slows down the progression of you receiving the equipment.
Wow, so that's really interesting. And so that pretty much answers the question right there on to why it takes so long. So pretty much it just like you said, it's just a number of layers that people have to go through. And so that will always slow things down no matter what it is.
Mhm.
Another thing I have within the same question though is, we do get a lot of times where clients are not satisfied of the quality items that they're getting
Mhm.
specifically from the insurance. So like, for example, hospital beds, that's a huge one. People value beds. You see them advertised on TV a lot. So, people do value having good beds that look nice, that match the room, that has a certain lifestyle appeal to it. Can you speak to some of the disconnects on that, right? Like, we do get a lot of times where I've talked to people where they say, look, I got this bed through the insurance. It was terrible. And so now they're at this point where they want to go and buy one out of pocket because they want something a lot better. And there's times where people are just kind of confused about, well, why won't Medicare pay anything towards a higher end bed, like a long-term care bed,
Mhm.
where we already know that they only pay for semi-electric beds, and so those are the beds that a lot of people complain about. But how come they don't cover a long-term care bed? Where are sort of disconnects there?
Well, first of all, the long-term care beds are the what we call the high. Well, a lot of times people high low. Well, high low long-term care beds, they are expensive. They're very expensive, and so the allowed amount that they reimburse now is like $74, and that's for like and then of course, depending on what state you're in, it may be a little bit more, but the fee schedule is pretty much for us. We're in California, and so we're looking at about $74 for the first 3 months. I think it's first 3 months, and then the fourth month or the fifth month, it goes down to like 40 some odd dollars per month. And
Mhm.
so the reimbursements just isn't there for them to pay for more of an advanced type of bed. It's just not there. You first have to even meet medical necessity even to get that particular one, which is normally a semi-electric bed, which the head goes up and the feet goes up and the frame goes up if you crank the bottom from the foot, right? And we will be doing a video about that and how and showing people the differences so that they could see it real time. But that is what the insurance pays for. So when you get into talking about the more advanced beds, which are the high, with the head goes up, the feet goes up, but the frame goes about 38 to 42 inches high, which is very, very good for a caregiver and for the patient too, because it serves a lot of times as a stand assist that helps the patient if you, depending on how you transfer the patient out, be able to allow them to kind of almost not stand up on their own, but give them that positioning them into a point where it's not so much work on the caregiver. Okay. And so that's what the hollow bed. And also they go low enough, some of them, to the point where if you have a loved one that is a fall risk, if they fall out of the bed, which this is the beds aren't low enough for the regular ones, the semi-electrics, they don't go low enough. And they don't go high enough or low enough, but they're, they do what they do. But if you're looking for more of a support, then that's where the long-term care beds in or your more premium type beds come in. And so then therefore it doesn't go low enough. So if you have a patient who's a fall risk, it is very risky because if they fall out, they're going to probably hurt themselves. That's just normally what's going to happen. So what happens is if you have a high-low bed, that bed goes low enough, about 9 inches. Some of them, just depending on the size of the mattress, it could be anywhere from 11 inches. But then there's a fall mat that you can put to the side. You definitely want to make sure that that's maybe 3 inches or more. So they can give that when you fall, the friction and all that. So that's for that. Now, one of the things that I want to say, and I just want to make sure this is clear, because we see this a lot, where families go on and they purchase beds. They purchase the hollow beds, and they are advanced beds, but some of them there you can't add rails at the end to it. You can't add rails. Some beds, they are great, they're advanced beds, but they may not be conducive to what your loved one has going on. So we see a lot of that. We see people spend thousands of dollars for beds that the bed is not conducive for that situation, what's going on with your particular loved one, and or the mattress is not conducive to what they have going on. And so that's why it's so important. I push clinical assessments. And a lot of times we say, what is a clinical assessment? A clinical assessment is when we take the diagnoses, we take the history of what's going on with the patient. We take what the patient is using right now. We take where, based on the condition and the diagnoses, what the progression could possibly be. So in other words, what you're using today, it may not be conducive tomorrow, which means in a couple of weeks. I've had patients who were walking, because an example, I'll give you a Parkinson's. Patient has Parkinson's, they're up, they may be walking, maybe moving slow. And then as you keep working with them, and maybe in about a couple of months, they're not even able to really move now. They're not able to, they're back down, they're like chair bound. And so would I recommend at that point, it depends on what I recommend, right? So in our field as a consultant, I'm going to make sure that I look at the whole picture, not just the specs of the bed. So when you're out trying to purchase a bed, that's why I tell people you want to ask questions. You make sure that whoever you purchase the bed from, that you ask them questions like, do you know, my loved one has this particular diagnosis. This is what's going, this is what the doctor is saying about my loved one. Have they mentioned anything about palliative care? Have they mentioned anything about hospice? That determines if you should be purchasing something or you should be trying to rent a premium type of bed, right? None of us know, but it's really good to be able to speak to a specialist or a consultant who specialize in this, that can actually take the clinicalness of the assessment and put that with the specs of the particular product, and then you narrow them down. So I'll give you an example. So like we work with, we work a lot of families. So I have a client right now, and we're trying to figure, well, we already have a recommendation for a particular type of mattress, right? And the certain ones have been tried and they have not worked. Okay. So what we've done is we take what's going on, what they've tried before, and now we're making a recommendation more for a more advanced type of product. Now, will it work? But chances are it is, because why? Because we have done enough of these. We've seen some of these diagnoses. We kind of know which particular product is going to work for this particular client at this point of time, if that makes sense, right?
Yes.
And so as long as the condition does not progress, but the particular product that we're going to recommend is going to be for now, and it's also going to be if something should progress later on. So I'm not going to give you a basic low air loss if you have a certain type of condition going on. We're going to recommend a more advanced type of low air loss mattress, as an example, to make sure it's going to cover you if that's, because now you don't have to go out and buy another mattress. They said they're not cheap. They're very expensive, right? And so if the insurance is only going to pay for a certain one, if they're going to pay for any at all, but depending on your, I have some clients that they don't qualify for insurance, pay for anything, because they may have, depending on their finances, right? So they're paying for everything out of pocket. Well, you want to make sure that they have whatever they need to make sure it's going to be covered for them, so that they don't have to go out and spend more money, because this equipment is very expensive sometimes, right? So that's why I tell people, you don't want to go and spend thousands of dollars on a bed, and now you got to go out and buy another bed. And I actually just had a client that just happened to. I mean, it happens quite often, but I'm talking about right now, recently, right, where they spent all this money on one bed because they didn't get they didn't have a consultation done, because they didn't know, because they went to a particular place And the particular place just sold them what they wanted.
Mhm.
When clients come to us, they say, I want this. And I'm like, well, hold on. Let's look at the full picture first. Okay, let's look at the clinical part of everything. Let's look at the what you're using now, what you've tried, and also to the surface, the sleep surface, because the frame is a frame, but sometimes depending on the frame, depending on the type of mattress that you're going to get and how it's going to work on the frame, that's very important, right? The
Yeah, like
functionality.
that's huge because I do know that, there are those out there who, like, for some manufacturers, especially the higher end ones, I know that they always like to push their own mattress on their frame because the mattress is designed for that specific frame. So the way the
Right.
frame moves, you're
Mm-hmm.
going to get that maximum comfort and functionality out of that frame because you have a proper mattress going on that frame because it was made for each other, right? So it's a perfect match. Whereas there's a lot of cases where we see that people do get a frame, but then maybe just to cut corners, just to save money here and there, and they don't really know up front they're getting maybe a way cheaper mattress, and then you get the bed and you spent the same amount of money, but then you're not getting that same experience, and so you're still kind of like stuck. You're not comfortable, and so you're thinking it's the frame altogether when actually just a sleep surface. And
Mm-hmm.
so, that's one thing that I would also add too is that when it comes to this level of equipment, it really does goes hand in hand with some other stuff. Like I always think about laptops and computers. If you're working a certain type of job and you're doing certain type of stuff, you may need more internal storage. And if you know that you're doing a lot of different things, you need more headroom, like they call it, right? So I think the perfect word to kind of sum everything up what you just said about the equipment is future proofing.
Exactly.
Future is very powerful because when you future proof, it's basically adding headroom, even though oh, I may not use all those features, right? You just never know, especially if it's a progressing condition
Mm-hmm.
that, like Parkinson's, where you're okay, yeah, you may be one way today, but then months later, now all of a sudden you also need those features. But if
Yeah.
you got a bed today and it doesn't have those extra features that's needed, and now all of a sudden you do need them, now you have to go back out and buy another bed that's more expensive. So you actually spent more money.
Oh,
I think it's basically a difference of, do I invest in something? That's why I always tell people that when it comes to this equipment, especially at the higher level, when you start going out of pocket, it's really an
yeah.
investment because you're
Really.
investing in today, but also potentially tomorrow. If things go south, you already have those features built into your system. So now you save a lot of money and a lot of stress because now you can address things on the go versus I get something today because I was like, oh, I only need these things today. But then now when it's time to go get that, now you're looking at another. I mean, some of this stuff can end up being like thousands of dollars beyond what you
Expensive.
already.
It is
Like, there was one guy there's one guy that I dealt with last year, and his situation was actually the same. He had bought four, and so he had said, yeah, like, I've spent almost $30,000 in beds between all four of them, right? And so it's like, wow, like you would have think on the second attempt, you would think, okay, let's try to see what's going on, but maybe the people he was dealing with, they didn't tell him, well, let's see what's really going on. Like you said, the clinical assessments are very
yeah.
important because that's going to help you address, well, yeah, based on your specific situation. Because I believe, and that goes into the second question I have for you with the clinical assessments, right?
Okay.
Is the clinical assessment, what does that actually mean in simple terms, right? So we think clinical assessment, we're thinking on average, you're thinking, oh, going to a doctor's office and a doctor doing some type of assessment on you, but actually what your clinical assessment is more so based on the medical equipment side. And so
Right.
just for you guys out there who are listening, to kind of simplify it, so as before Tara gets to it, is simply just saying, you're looking at, let's say, for example, you're looking at a advanced rotation bed, for example, right? You saw it on Google, you saw it on some type of online, and you're saying, look, this will get the job done, right?
Mm-hmm.
But there's some things going on that you may not notice. And so what Tara says, the clinical assessment, she's going to address, okay, what's going on clinically and what is your goal? So that way you know both things, and so
Mhm.
you're able to guide. You're able to basically come up with a proper assessment. Okay, actually, even though you went for this bed, you actually this bed over here because of these list of reasons, and this bed will actually not only help you right now, but it
Mhm.
also has extra built-in features in the future if things were to progress. But can you expound upon that though?
Exactly. And I kind of touched on that earlier about the clinical assessment, but I go back and to make sure I don't miss anything, diagnoses, mobility level, pain points, home layout, caregiver ability, all those
Mhm.
things are just some of the things that we look at, right? So even though you may come to us and say, you know what, I saw this rotation and we've had this happen. Oh my gosh, I want this rotation bit. And I'm like, okay, well, hold on. Again, right? And by the time we finish, with everything, the rotation bed was not conducive to what they have going on, right? Based on
Yeah.
what all the different, when we got to and just peel back the onion, we was like, you know what? Unfortunately, I would be doing you a disservice if I recommended you to get this rotation. And then after we lay everything out based on what they have going on, they're like, oh my
Mhm.
gosh, thank you. Because we really wanted to get that, but it makes sense, right? So a
Yeah.
different type of bed um would be more conducive. Right. Not to say that because rotation is amazing. Like it does everything. It's like a bed and a reclining chair in one. It does
Yeah, yeah, it is. It's
but
yeah, I've seen it up close. It's a very powerful machine.
powerful. Oh my gosh, it is the top of the top, right? Especially it is the top of the line. But it depends on what's going on with the patient because again, if you have a patient who is a fall risk, it might not be a great thing depending on it's so many different things that we look at, right? And so there's all these different levels of things that we look at to make sure that the diagnoses and the condition of the patient needs to match the equipment, not the specs, because I go back to this constantly. Anyone can sell you a product based on the specs. Oh, the specs are great, what the chair does or what the bed does, but is it good for what you have going on, your specific situation? And that's what is so important. It's so bad because we see so many families purchasing equipment. It doesn't work. It doesn't fit in the room. It doesn't fit in the bathroom. It's breaking down. They're leaning over. I mean, it is just insane, and it's getting worse because more people, 10,000 people turn 65 every single day. So a lot of people are aging in place
Mhm.
and they need equipment, they need assistance, and all these things. And the money that people are spending and the things that people are buying, we're seeing it like constantly. The calls are just unbelievable. And that's why we keep doing this and we keep talking about it because it's so important that you get a clinical assessment. It's so critical. So what we've done because of all of this and we were seeing and how it's so many people going through and we've seen so many people spend so much money and let me just say this. I've been a patient advocate for a very, very long time. So yes, I do clinical assessments, but I'm a patient advocate. I've been doing patient advocacy work for years, educating families, talking to families about what's out there when it comes to healthcare, not just equipment, but just even with insurance, all those different things. And when they workers' comp, personal injuries, all those things, right? And so for me, it's painful for me to see families to spend money or to, go through all these hoops and all these challenges when they just need to know the information. And so because of that, I know the next question you're going to ask me is about the app, the
Yeah,
CFS
the app. Yes.
free
That's what
app.
I was going to get to. Yeah, the free app.
Yes.
Yeah, because
Yes.
like I've been on the app, and the app is very, it's very good.
Mhm.
It has a lot of information, details about medical equipment, just pretty much everything. And so, does this go into why you created the app?
It is. um for a long time, for years actually, I was like, what can we create that people can have access to just help them, right? And so it's like, okay, let's create an app that it's like information based app, right? So the app has blogs on there, The blogs are really conducive to like giving information as to different products and what to look for, what questions to ask, things like that. We also, of course, interview other professionals in healthcare, and those are blogs, and you can listen to of course, the podcast and hear their information too. There's great resources that I've had people reach out to me for certain things, and they're being able to contact the people we've interviewed on the podcast by going to the blog and pulling their information off of there. Right. So we do that, or we try to do a lot in the community. So giving back this year, we also are going to be doing free in services for churches and organization, nonprofits with different organizations to just share information that we know, so that when the time comes, or if you're a caregiver or you're in need of some information, you kind of preparing yourself to understand what to ask your doctor, what to ask the insurance company when you call them, all these different things that you can actually get on the app. There's videos. If you purchase a particular product from us, or if you have a particular product, I don't know if it'll be on there or not, but we're also having an ad where the video on how to use the product, how to put the product together, is going to also be on the app, and you can download the app on Apple or Google. It is free, and the videos are going to be free. And now there is a membership, but I think it's like $12.99, and that is a little bit different. That's a membership where you get actual, like, different, I would say, different categories of equipment. So you get to see what are the basics, from basic type of, an example, wheelchairs to transport chairs, which ones are covered, what the billing code is, what to ask the doctor, what all those type of things. That's like $12.99, and you can cancel whenever you want. But most of the stuff on the app is free. It is a free app. And of course, we do have tiers of one-on-one consultations. If you have something a little bit more deeper that you need to do a consultation one-on-one, there's a fee for that. But every single dime of that is applied to the purchase of the equipment, if you decide to purchase the equipment. If you don't, either way, you're going to get a report on what the recommendation is for you, so that you can go out and make a sound decision, or at least you have the information to prepare you for whatever decision you make. But if you decide to move forward with a particular product, you're going to get the full amount applied to the product. So you really got, yeah. And we do that because of the time and the many requests that we get. And so, yeah, but that's why we created the app. And so I'm hoping and praying that it can help relieve a lot of stress from people that's out there just trying to figure it out, because it is a lot. And I get people calling and they're crying because they, got a prescription, they didn't know what to do. They've been given the runaround. They've called here, they called there, they everywhere. And this is not just here in the United States, just anywhere. We cover this information is it's just straight across the board. You don't have to be in California. It's worldwide. So you got people getting product all over the world. And so whomever need it, the app is there for people to try to get the information that they need, to get the assistance that they need, to make things just a little bit more easier, and understanding how to navigate this world of medical equipment, because it doesn't get talked about. No one really talks about it that much. No one really tells somebody like how to navigate the system. And it's a process, but I think when people know better, and a lot of times, and what I get to is so much of people like, oh my God, wouldn't nobody just tell me? If I knew what was involved, I could have been able to, take care of my loved one properly. I can, get this. And, it's just resources. And so, and that's another thing too,
Yeah.
what we built is a network of resources for not just equipment, but for all different type of levels of healthcare that people can pull from the app.
Yeah, and that's one other question I have for the app is because I see there's a lot of resources, there's a lot of things you could take away from the app. I mean, pretty much the app by itself, I mean, if you're a really more, deep research type of person, you probably just go on there and get all the information, and you know exactly what to do right after that, especially after you watch the videos. There are, and so that's another thing too. On the app, is there a difference between the free content and more paid consultations? So like I know there's where you can get one-on-one consultations. So can you explain like what's the the barriers on that, like as far as like where the line is on that?
Okay, so you mean from the free, like the free videos where people would just get free. Well, the videos, there's going to be videos on there that actually show you, like an example, if you purchase a particular product and you may be struggling, if you may get it drop shipped to you, you may not be in California, but you order a particular product from us and it's shipped to your home. You'll be able to go onto the app, you download the app, and that video is going to be a video on there showing you how to put that product together, right? How to use the product. So then you will know. So you're not just buying it and being left alone. You'll be able to go on there and get that from the app, right? And then as far as when it comes to the one-on-one, and now we get a lot of these because everybody's situation is different, right? So we can put like a surface level information of free information, and that's fine. But when it comes to, we have clients that get customized chairs, we have patients who want special type of beds, and in that situation, that's when we do a virtual, like for instance, if you're in a different state, we do a virtual consultation with you where I do training. I show you how to, do the measurements for your loved one, inside the home, outside the home, all those type of things. You can get that. And so that is a fee for that. But again, it's applied, the amount that you pay is applied to the purchase of the particular product if you decide to move on with the particular product. And then also, we do have local here where we actually come out to the home and or the facility, and we do a in service or a consultation and measurements and all those type of things. So you get all of that. That's a paid service. But it's like, well, I think one tier, the first tier is 99. There's one for 199, and there's one for 399. It just depends on what you need. But again, that's more personable because now I'm going to do a full on assessment with you. We ask you all these questions. You have families that can be in different states or countries. Because we got some families, their loved one is here in the States, but they're in another country, right? And they want to make sure their loved one is taken care of. So everybody can be on the Zoom, a virtual, whatever that we use, which is normally Zoom. But we get on Zoom and they're able to see things real time. I'm able to talk to them. We're able to ask questions and everybody participate, right? Even down to the caregiver. And so that way you can make a sound decision. So those is when the consultation and all that comes in to play. And so we do that all over. And it has been really good because now people feel like they have a peace of mind. They don't feel like, oh my God, like now they don't feel like they're making the decisions that they would have made, and it kind of saved them a lot of money. Saved them a lot of money. We've saved people a lot of money. We've saved them a lot of stress, and so that's what we do. And so we create
Wow,
that. Mhm.
that's really good. Yeah, I mean, like I said, I've been on the app. The app is very good. It, has a lot of information. I like how it really focuses on all the advanced equipment that's out there because one thing that I see a lot of is like a lot of advanced equipment, the rotation beds, the beds that the long-term care beds,
Mhm.
especially the ones that you deal with, right? I get a lot of times I hear people say like they never even seen these beds before, they ain't even heard of them. And these are some people who have worked in the industry, who have been to multiple companies like yourself, and they said that we never, the kind of equipment you're handling with, we never dealt with it. And so is that mainly because of, is it because of just kind of like the disconnect of people just don't want to get into this advanced equipment? Because I'm noticing that when you look at what those kind of equipment is doing, it really does check all the boxes. Like, can you speak on, let's just say, for example, like the latest interaction you had where people have said, look, they went through your one-on-one consultation and they actually got the product and used it, and it's like from out the gate a total success.
Yes, I have several success stories, but I'll only share two. So we have a client that she purchased she did a trial, actually a demo with her father, and she brought him in from a different state, and he was having some challenges. And when he got here, he did a demo with one of our retractor beds, and she ended up purchasing it for him. And the response was just amazing. How he was feeling better, and he had some movement in his legs that he didn't have before. because of the contour and the level of the surface mattress he was sleeping on and all these different things. So that was totally amazing. And we love hearing these type of stories, right? And or we have a client who comes in and he's been so restless, he wasn't able to sleep, he's a Parkinson patient, and as soon as he lays on the retractor bed in the mattress, he falls asleep, right? Like,
Wow.
yes. And so
Wow.
it's like,
But
yeah,
the
we'll take
one
that one.
that's
Yeah.
yeah, now the one that's really deep on though, so basically you're saying is that like the bed, especially the first one where you said that he went from not being able, like he went from not having much movement in his legs to when he got on that particular bed, and after like a couple days or like a couple weeks, he's now starting to get that strength back. You know,
Right.
is that correct?
Even even his being alert, just the attitude, his his personality, even all those things, because now he's getting rest, he's able to rest, he gets sleep, he's comfortable, right? It
Mhm.
matters. And so those are the type of stories, like we hear them all the time. And then those are I mean, my goodness, like I yeah, I'm overjoyed when we hear that. That's the feedback on some of these. And then I'll give you another one where I had a lady and she actually purchased a bed for herself. She purchased a rotation bed, and she
Okay.
was in a different state, but she purchased a bed for herself. And her mother just happened to be over at her home, and she's in her 90s. And she was keeping her because her sister was going on a vacation. So she had her mother at her home for about a week. So she had her mother stay in the bed, in the rotation
Okay.
bed. And she could not, but the mom was like, her whole be everything was just starting, like she was starting to smile and she was just feeling better and all this kind of stuff. Actually, she's in the process of purchasing her mother a rotation bed. And the crazy part too is the caregivers could not believe it. First of all, they was totally shocked because they had never seen a bed like this. But even so, they were like totally impressed with the movement of their or her mom and where her mom is now in the movement. So the therapy was just, they were like, oh my God, like, yeah, you need to get your mom one of these beds because we've seen her moving. She's smiling. She's, she was up eating, so all those type of things. It's just, you can't put a price on that. Like,
Wow. Yeah. So
yeah. So
that's
the
amazing.
stories
Yeah. I mean,
are endless. Like
yeah.
it's,
It's endless, yeah. Like,
yeah.
you know, because especially once you get into you know, you're like the equipment that, you know, you're dealing with, the advanced equipment, you know, because they've been engineered, right? And so like
Oh,
I know one company, they had said that one company, like it took them like 10 years to engineer one of their beds, right? 10 years. And so that's another reason why some of the prices may be really expensive, because what they're doing is they're not just throwing some you know, metal and steel together to actually, you know, make sure that this thing is working in application, and make sure it's safe for multiple kinds of settings, right? So there's no danger or anything like that. And so, you know, that takes a lot of manpower, that takes a lot of, you know, engineered brains together to, you know, make something that can really work. And so you're really paying for the engineering, really. And so but that concludes today's episode, you guys. You know, once again, this is Tara, you know, the medical equipment world, get the scoop. And so we'll stay tuned for our next episode. Our next episode, we're going to be really in the showroom. And so Tara is going to show us the different beds, especially because the beds are a huge topic that, you know, a lot of people we see, you know, a lot of people have issues with, you know, choosing the right bed. Like recently we had one, I would say for myself, I had one client I was talking to earlier, and by them not knowing what's out there or having not understanding the differences, they
mhm,
wanted a bed that's like, okay, they wanted a bed that, you know, that can hold a lot of weight. We're talking like past 600 pounds,
mhm,
but the beds that were available were beds that more clinical looking, right? You know, just your, you know, your more of your med surge type look, but they wanted a bed that looked like a home style bed, right? And so,
right,
but then the only problem is though, is that, well, those beds that can cover the functionality that you're looking for, plus the aesthetics to look like it matches your home, those end up being way more expensive. And so now you're kind of caught in this place where, okay, what is more important? Is it the aesthetics or the actual functionality to, you know, make things easier? And so, but
right.
we'll go deeper into that into the next episode. So stay tuned. And any last words, Tara?
Yes, I would just say that before you purchase equipment to get a clinical assessment, um, just make sure that when you go to a company that you are, if they don't ask you the questions, then you ask them the questions. Ask them about, like, let them know, like, hey, I have my loved one. It's your either yourself or your loved one, and or do you know what would be best for me based on this particular condition? Hopefully they would know that. Hopefully they can you know tell, say yes, oh, based on your condition. But just let me say this: a lot of companies may not offer that. They may not offer that. Maybe they may just be selling products on the specifics of the product model, the specs of the product, right? And that's fine if that's what you want. But I will tell you, based on, I've been doing this for over 30 years. I've been in healthcare for a very long time, and I've been doing equipment for a very, very long time. And I would just tell you the best option would be to get a clinical assessment. And so if they don't offer clinical assessments, where they take the information and narrow down based on the clinical part of it and the specs, then you should find someone, a company that can do that for you. I would say that would be my suggestion to do, and then do your homework as well. Match the bed, see based on the condition of what your loved one has going on, if that particular bed is going to be conducive for them. Like, there's you do your homework, do the research. Don't just settle for, oh, you saw a bed online and you saw it's doing this and that, and you want to go and purchase it. I would tell you to pause and then just do your research. You definitely can reach out to us because we do them all over. Our number is 310-817-5373, and that's CFS Medical Supplies and Equipment, CFS Solutions. And the CFS Solution side is the consulting side. That's the side where we do the consulting, the tiers, and all those different things. And so I would say that. And download the app, download the free, that's right, free app to get those videos and get those free blogs, and then you get to the different uploads of different blogs too. Has some really, really good information on there and different resources and things like that. So please go ahead and download the app. It's CFS Medical Supplies, and it's under Apple or Google. And so yeah, and then just listen to the podcast to try to get more information. And you can actually you can all do all those things on the app too. I forgot to mention that. You can, when you download the app, you can listen to the podcast from the app. You can get directly to the medical equipment side website from the app. You can actually get all the different blogs from the app. You can see the videos from the app. You can get the gallery from the app, and then they're adding also the equipment, how to use the equipment and all those type of things too, that will be actually free on the app as well. So again, you've heard it here on the Medical Equipment World and Healthcare Get the Scoop, and we will see you on the next episode. Have a good day.
All right.